My name is Thorpe. I'm from Mersey Care NHS Trust. I'm an employment specialist. I've worked in this thing called supported employment for about 17 years. And I was a supported employment advisor, and then IPS came along, and I now work in the IPS service. So I guess the perspective I'm bringing is how we made sure a supported employment service became an IPS service, and actually some of that change and some of the lessons learned from that. I'm coming very much from a practical perspective here, so just some of the lessons we've learned, some of the difficulties we've encountered, some of the things that I think have worked for us, and some of the questions we perhaps still have in implementing IPS. Just to give you a bit of background to Mersey Care and network employment, and I'll keep saying network employment because I'm a real believer in a strong brand for IPS and employment, so I sort of wear two hats. I wear my trust hat, but I wear my network employment hat. Mersey Care is a specialist mental health trust. We have learning disability, brain injuries and addiction services also. We also have high, medium, secure services, and everybody's probably heard of Ashworth Hospital because we've got a couple of famous residents there. The trust at the minute is divided into clinical business units, and I work within the Liverpool clinical business unit. So that covers pretty much city centre Liverpool, high as and deprivation, quite a large population using mental health services. Within Mersey Care there are two IPS providers. There's ourselves, and we're an in-house service. There's a third sector provider up in Sefton in the northern part of Merseyside, Imagine Mental Health. We work quite closely together, and we both work to the IPS model. And as I said, we were an existing in-house supported employment service that started in 1996, actually in learning disabilities. So a lot of my background, a lot of the values, beliefs and principles that I bring to IPS, I guess I've brought from that background of working with people who are very disenfranchised, written off, seen as just not able to work. And that's been important for me in going into the community mental health teams and the values that we've held dear in network employment. And in 2011 is when we started doing IPS properly, if you like. We tinkered around the edges before then and started IPS properly in 2011 and went through a process of organisational change. It was budget driven, we lost staff. So there was a big learning curve there. My role changed completely, and I guess some of that change that I'm going to share with you. So first, co-location. We keep talking about it. I was a disbeliever. I didn't think it worked. I liked being in my specialist supported employment unit. I liked the support of my peers and colleagues who were all of them employment advisors. But co-locations worked. So what we did is because we were actually becoming a smaller team, we had a selection process, and employment advisors were co-located and integrated into community mental health teams. Co-location isn't necessarily integration. They're two different things, and our trust was very keen that we were integrated. So guess what that meant? I'm managed by a community mental health team manager. The employment advisors are managed by community mental health team managers. We're in there, we're part of the community mental health team, we're integrated as part of the team, not just the person who does employment. And our budget was integrated as well, so we actually manage budget. Our budget comes into community mental health teams, which means that actually the CBU, those leaders in the CBU and those community mental health team managers are making quite a strong statement decision that they're going to spend money on an employment service. They're signed up to it. It's coming out of their budget. And I don't think this has been mentioned, it might be a bit of a given, but clinical information systems. We actually have access to and input into clinical information systems. Our employment notes are integrated into them. And that's important for a couple of reasons. One, we have access to information that we need that we didn't used to have access to. And we don't get into strange situations where we go out to people's houses and they're swearing just at the letterbox because no one told them we were coming. And actually they have a problem with same gender support. The other way it works as well is that actually you look into people's clinical notes now, and it's not just about medication and whether they attended the day centre, there's actually a little bit of hope in clinical notes. The actual positive things from employment and things that we're talking about are in part of someone's clinical notes. And from my background, that's actually quite important to me. I like to see that in there. So that all sounds dead easy. It wasn't. I always say, like, it was one day we turned the lock on network employment here, and the next day we all sat in the new desk in our new team with our new managers. And it sounds really easy. There was probably a process of 6 months of negotiations, meeting managers, attending community mental health team meetings, having day visits, a whole process we had to go through to do that. And the same with clinical information systems, that actually took us 4 years to get through information governance committees and everything. So it sounds simple, but they can be quite challenging things. However, we maintained central employment functions. So we're still a specialist vocational unit in some ways. And this is the bit where I'll fight. I'll fight for this. So that's me, Specialist Operational Lead for Service. We call our employment specialists employment advisors. It's just semantics. And employment specialist. So I maintained a specialist operational lead. And as I go through the presentation, what that means will become a bit clearer. But basically, I do the professional supervision for employment advisors. I have a responsibility for the service achieving its outcomes. I have responsibility for the service continuing to develop, and I have a responsibility for going out there, selling the service and being a representative of the service and of Mersey Care as well. We were a pre-existing service, so it was really important for us to maintain that. We already had employers who knew us, third sector agencies. We already had a very strong relationship with the DWP. But also from a branding point of view, I don't like the words NHS and mental health being mentioned in our brand until I'm face-to-face with an employer and I can explain things. And that comes to the next thing, centralised point of contact and admin for the employment team. Sounds really small, but I wanted our phone picked up with Hello Network Employment, not, as we get, if you've won some of us, Hello Hospital. Because if that's an employer on the other end of the phone, it's not the best impression. So I really wanted to keep that. And as I said, the importance of maintaining that specialist vocational unit with peer support. Being an employment advisor can be very isolating. You're out in the community all the time. You are doing some different things. You're talking to employers, and that active job development is tough sometimes. And actually support from peers in the vocational unit as well as from your peers in your community mental health team is really, really important. So this is a bit about the nitty-gritty of how we do some of those central employment functions really. So as I've already said, I did professional supervision. So practice supervision, shadowing, joint visits. I'll facilitate planning meetings for employment advisors jointly with them. So they've got that strong leadership there in terms of employment, as well as the clinical leadership from within the community mental health team. Personal development plans are done jointly with myself and the community mental health team manager, so that employment outcomes and goals don't get lost, and the need for specialist training for employment advisors doesn't get lost in the sort of, have you done your medication management or have you done your MVA in the last 3 years? We meet once a week on a Wednesday morning. We share a couple of stories of people we're working with who we want help, advice and support, almost in a group supervision model with each other. We share information on what we're looking for people, so when we're out there we know for the whole team and we're not just our own little insular worlds. We look at what jobs we got, we look at what employer contacts we've had, we look at any peer support or buddying needs, and I'll talk about buddying in a bit. And again, that keeping that weekly meeting has been so important for us. As well as being integrated into clinical information systems, we actually have kept some disability record keeping systems. There isn't a way on the clinical information system of recording our employer contacts. So we've had to keep those. We also have distinct timesheets for employment advisors, which are a really good management information tool. We've kept a lot of the tools that we used before we moved into the mental health teams because of the work. So all our employment advisors are trained in lots of different person-centred planning techniques. from graphic facilitation through to essential lifestyle planning. We use WorkStar as a planning tool. We toyed with Recovery Star, didn't really work for us as an employment team, so we use WorkStar now. And something called Job Notion meetings, which is a really good tool for us of getting people together and sharing ideas about someone's employment aspirations and their ideal job, and involving the important people in their life in that. Involving families and carers and someone's employment goals and aspirations is so key to what we do. We have a tick box on our employment profile form, and we have met with person case consent, discussed disclosure, permission to contact DWP, met with important people in the person's life. And it's on that tick box, it's so important. And the buddy system, I said I'd come back to this. It's really simple. Most people in our service will have been given another named employment advisor in case we're not there, and they'll have met them and will have done some joint visits. So that even if they're not in your geographical location, if I suddenly go off next week, at least you can get a service and you can get some help and support. And we've maintained that, and that's been a little bit of a struggle with the IPS model because it's geographically based, and how we've been able to manage that. And it's a bit of an ongoing struggle that we just have to keep on top of. But it is something that we felt we had to maintain for our job seekers. And joint sales days. Employment advisors go out together to talk to employers. Do it on their own as well, but they support each other, and we go out there with each other as well. Employment advisors fill these in weekly, and they break down the activity they do by the type of activity and the job seeker. And I use these in supervision and PDPs for employment advisors to look at how they've been carrying out their activities, or the particular patterns of particular job seekers, and how effective that's been in getting outcomes. So, for example, I could go to an employment advisor for a particular 6 months and tell you exactly how many hours they've spent in employer contact, how many contacts they've made, and how many jobs they've got in that 6 months. So we can see the direct correlation between those things.